Hi, my name is Dr. Greg Doerr, and a question was posed to me that I decided that I would kind of formulate a response and be able to share with you guys. So the question was, how do you actually integrate manual therapy into a chiropractic office? Now, one of the things I'm actually known for is, obviously, I've lectured internationally for the last 18 years on soft tissue. I was the co-developer of Factor, and since then have developed functional soft tissue, and again, based around soft tissue treatment as one of the major modalities during those classes. Now, I've been doing soft tissue since I pretty much started in practice, so integrating it into my practice was something that I did initially. The biggest challenge most people have with integrating soft tissue into their practice is the length of time necessary in order to accomplish your goals. Now, the great thing about that is most people over-treat. The amount of time you need in order to actually recreate those responses is a lot less time than what you really think it is. If you're trying to neuro reset a tissue, all it takes is a hyperemia on the skin, and you can retest to see what the dysfunction was and find out how much faster it is. It's minutes, it's seconds or minutes. When you're trying to treat tendinopathies, we don't need to treat a tendinopathy for 2 minutes. We can do it in 10 or 15 seconds. You can get 3 sets of 10 in and not even hit a minute, and your tendon treatment may be over. So the only challenge that we have is when we're treating kinetic chains. Kinetic chains can take a long time. If we're taking care of a baseball pitcher and working all the way from an elbow, through the shoulder, into the back, down to a hip, that can take a lot more time, and it depends on your practice style. If you run on a tight schedule like I do, you may only have about 12 to 15 minutes of hands-on time with that patient. And doing all of that in one time is a little bit much, especially if you're doing some taping and especially if you're using some manipulation or mobilization techniques as well. So you might not be able to get all of that done in a single day. That's where you have to recognize what your practice is, how many people do you see in an hour, and how it is and how much time you have to do your soft tissue treatments in your office. Now, that's your first step if you've never done soft tissue work before, is look at your practice structure, look at what it is that you need to do, then learn how to do these things. The more you do them, the faster you get at doing it. However, soft tissue and manual techniques like that are the fastest way to neuro reset tissue. If you want the fastest pain relief you could possibly do, you're going to find that out by doing a lot of these soft tissue techniques. You find out what's a provocative activity, you treat during that provocative activity, and you basically retest it again. You will see patients will drop, in the way that I do it in my office all the time is, if it was a 10 when you first raised your arm up, what is it now? You want to see a minimum of a 50% reduction in those symptoms during your soft tissue treatment to make sure that you've actually stimulated the proper neurology. If you haven't, you've missed the body part. It's most likely something different, and you have to reevaluate the situation. That doesn't have to happen on that individual day, but can happen on your second visit. So soft tissue, again, is probably one of the most critical things to bring into your practice for the fastest pain relief, the quickest neuro resets, and the greatest way of remodeling tendons, ligaments, scar tissue, things along those lines, and to be able to give your patients immediate pain relief when they get off the table. I frequently say, you don't have to love me when you're on the table, you got to love me when you get off it. So once again, I'm Dr. Greg Doerr. If you're looking for more information on soft tissue treatment, I'm easy to find. You can always ask me, send me an email, and I'd be happy to tell you how to help integrate that into your practice.